name is Iris Zink. I'm a rheumatology nurse practitioner. I've been in practice for 26 years in rheumatology. My husband and I own and operate a clinic in East Lansing, Michigan, where we serve the underserved. We're about 50% Medicaid in our current population. Today, I have been tasked with describing the TYK2 STAT signaling pathway and immunological rationale for TYK2 directed therapy for the treatment of lupus and Sjögren's. So first, we're going to talk about Sjögren's. Sjögren's disease is the second most common autoimmune disease, affecting about 4 million Americans. The problem is about 75% of people who have Sjögren's disease do not know that they have it. They're not fully diagnosed. Sjögren's disease is a systemic disease. We know that. It affects many areas. It mainly affects the glandular tissues, the lacrimal glands, the salivary glands, and the Bartholin's glands in the vagina. It increases the patient's risk dramatically of having interstitial lung disease. And the biggest problem with Sjögren's is there's a 44 times increased risk of lymphoma with these patients. That's why it's so important to treat it. That's why it's been so devastating to tell patients for the last 26 years that they have Sjögren's and not have any treatment options for them. So why is this risk so high? That's what I'm going to try to teach you today. So stay tuned for that. So let's talk about lupus. We all know about lupus. It's a systemic disease that's an autoimmune disorder with abnormal cytokine signaling, creating tissue injury. We all know that. Serum levels of Sjögren's patients have been found to have high levels of interferon compared to healthy controls. Case controls of serum levels of patients show that both patients with lupus and Sjögren's disease have higher levels of the cytokines interleukin-23, BAFF, interferon gamma, as well as type 1 interferon and interleukin-12. So now let's talk about what is a cytokine. Because whenever I'm doing these lectures, I always do people even know what a cytokine is? But the best thing is I have 6 daughters, so that's the easiest way for me to explain to you what a cytokine is. A cytokine is a pro-inflammatory hormone that's constantly in communication with other pro-inflammatory hormones, drawing drama into the body in this situation. We need our cytokines. If we didn't have cytokines, we wouldn't get over infections. We'd all have cancer because TNF patrols for cancer cells. So cytokines are very important to the immune system, but in autoimmune disease, we have a hyperproduction. It's just like my daughters. They're on Instagram and Snapchat and Vine and TikTok and the Facebook. They're always drawing other people into their drama. That's what these cytokines do. They hyperproliferate, they communicate with each other, and they draw more drama into the cellular space, the bloodstream, whatever, creating issues within the body space that should not be happening in autoimmune disease. So why is TYK2 important? People who have had mutations with a loss of function of TYK2 in their body or tyrosine kinase were less likely to develop lupus and Sjögren's. So did you get that? So people who are born with a mutation where they did not have TYK2 proper functioning were less likely to develop lupus or Sjögren's. So we know that TYK2 is heavily involved. TYK2 is essential for normal immune function. Unlike JAK1, JAK2, and JAK3, TYK is only involved in immune processes. Therefore, selectively targeting TYK2 is a viable approach for managing autoimmune pathways. TYK2 is an intracellular kinase that relays immune signals to TYK2-dependent pro-inflammatory cytokines, those messengers we were just talking about, such as type 1 interferon, interleukin-23, interleukin-12. So I'm going to show you a picture of that. So this is what TYK2 looks like in Sjögren's. So on the extracellular membrane, so on the outside of the membrane are these little 2 grabbers, right? So when the TYK2 and the JAK2 get together, they're a pair of shoes. They're on the inside. They're brother and sister, but they're still a pair. When those 2 get together, they extracellular have these launching hands that can grab in interleukins like interleukin-12, interleukin-23, and interferon. When that process happens, either in the B cell or in the T cell, which the T cell's on top, the B cell's on the bottom. When this process happens, downstream, you hyperproduce BAFF, you hyperproduce cytokines, which then further downstream can create plasma cells that cause autoantibodies and increased cytokines in the system. So that's kind of a brief understanding of how that happened. This is TYK2-mediated pathway pathophysiology in systemic lupus. So again, it's intracellular on the dimers, which is the JAK1 and TYK2, and then the JAK2 and TYK2 on the T cell. those dimerization, and then there's the extracellular part, which is the little grabbers on the outside that are pulling in these cytokines. Then downstream, they create these B cell autoantibodies. So where the B cells are hyperproliferating, you see too much BAFF, you see autoimmunity cytokines, and you also see this increased inflammatory cytokines. Downregulating TYK2 signaling pathways offers a promising target for treating both Sjögren's and lupus. The hallmark of both lupus and Sjögren's disease is high interferon. The interferon system is our most fundamental defense system against infections. But in lupus and Sjögren's disease, the ongoing production of interferon perpetuates the autoimmune disease. It gets us in this cycle. Inhibiting TYK2 kinase involved in the interferon pathway reduces the production of interferon gamma and interleukin 12 and other inflammatory cytokines that are inherent to the disease process. By inhibiting the activation of T cells, T cell dependent B cell activation is reduced, leading to lower levels of double-stranded DNA antibody, which we know are critical factors related to lupus nephritis. Cytokines, such as interferon, modulated by the TYK2 pathway, contribute to the inflammatory cycle of lupus that leads to autoimmunity, chronic tissue injury and systemic disease, and damage to skin, kidneys, and the joints. Targeting the TYK2 pathway helps to restore the immune balance, reduces autoreactive B cell activation, and decreases the organ damage in lupus, such as nephritis. Interferon is particularly important in lupus as it is found in the skin, the joint space, and the kidney tissue. Interferon leads to creation of BAFF, which is super important in Sjögren's, as it both proliferates the B cell production and also has anti-apoptosis effects, signaling, telling the B cells not to die, not to explode like they're supposed to be when they're abnormal. This increases the risk of abnormal cellular activity, contributing to the really high lymphoma risk. So let's talk about my analogy. So you've all been to weddings where they gave you bubble guns, right? Not bubble gum, but a bubble gun, right? So it's a gun that makes bubbles. Children play with these, right? So we're going to talk about what a bubble gun is and what it does and how this is related, because that was a lot of science that I just laid on you. So think about a bubble gum maker that kids use. Some bubbles are big, some bubbles pop immediately, some fuse together into these abnormal, like bubbles that just, wander off into the atmosphere. Just like the bubbles, the hyperproliferative B cells are too numerous. They lack uniformity because some of them are all made differently, and they tend to cause lymphoma downstream. This analogy perfectly captures this B cell dysregulation seen in the diseases. The proliferation. The gun, the bubble gun, is stuck in the on position because of high BAFF and high interferon. So it's creating all these B cells, which are abnormal shapes and sizes. The lack of uniformity. So autoreactive B cells should have been popped through apoptosis, right? But they survive and they fuse into these autoimmune kind of complexes that are dangerous to the body. And then the lymphoma risk. So there's a 44 times higher lymphoma risk in Sjögren's disease, largely due to the constant frenetic signaling favoring the emergence of chromosomal abnormalities, allowing mistakes and mutations in the DNA to be created in our body, which shouldn't be happening, right? The B cells should be all the same size, marching off the factory line. But in this case, it's not. They're all different shapes and mutations, and that's what perpetuates this lymphoma risk. TYK2 may essentially take the batteries out of the bubble gun, allowing the body to return to a state of homeostasis. So in summary, I hope that you have a better understanding of the physiology of Sjögren's and lupus, particularly regarding the interferon BAFF axis. By focusing on TYK2, we are targeting the on switch because TYK2 is essential for mediating type 1 interferon, interleukin 12, interleukin 23. Thereby, inhibiting TYK2 provides a targeted approach to reduce the pro-inflammatory cytokines that we use to manage with these broad spectrum medications like MMF and methotrexate. It's just a more targeted approach. So there is this inhibition cascade. So I want you to focus on the right side of this chart, the therapeutic benefit with TYK2 inhibition. So for cytokine signaling, We block the intracellular relay, quieting the inflammatory signal at the source. The BAFF regulation on the right-hand side, lower levels of interferon may attenuate BAFF production. B cell maturation reduces T cell dependent B cell activation and thereby double-stranded DNA autoantibody production, literally attacking your own DNA. And then in terms of organ production, if you inhibit TYK2, you may lower the immune complex deposition, therefore potentially reducing Sjögren's and lupus activity. I am so glad that you sat with me today and learned about TYK2 and the signaling pathway. If you have more questions, please visit the WRAP content room. My name is Iris Zink, and I really appreciate your time and patience with me today. Thanks.